everyone. Thank you so much for joining. I know we're a bit before 4:30. I am filling in for Anne today because she got called to a hearing. So we will get started around 4:30, but hopefully you all are seeing my screen. Can you see the PowerPoint? Okay, good. We'll start right at 4:30. All right. Well, it is 4:30, and my name is Sarah Dearborn. I'm the chief over our medical, dental, and behavioral health benefits coverage at Nevada Medicaid. So I appreciate everyone being on today and being flexible with not your typical host. So Anne was called to a hearing today, so she's not able to join us, but we're going to do our best to maneuver the great agenda that we have for today and presentations as well as hopeful discussion as well. I do want to note, because all of you, I'm sure, are very active in the legislative session. We are hoping to do a legislative update in June as well, just for this group. So we can all stay on track with everything that's moving forward there too. And Amy, I saw your hand up, but that could have just been a mistake. Okay, so I'm seeing that. Thank you. All right, for today's agenda, we'll do our introductions and roll call. We are going to do our roll call a bit differently to save on time today. We'll also have some follow-ups from our April working group. And then we'll do a quick update on our behavioral health outpatient rates. We originally had a public workshop, I think, back in March with that, so we'll update you all on those. We will also be having a presentation on Black Youth Mental Health Advisory Board. And then we'll also have a presentation and discussion on our youth peer support services that we're proposing for our state plan, as well as our Medicaid service manual chapter. And then we'll do a wrap up along with public comment and adjournment. So as mentioned, we are going to do roll call a little bit differently today. So rather than announcing and going through the very comprehensive list, we thought it may be easier to capture everyone's names. If you can all add your name into the Teams chat to confirm your attendance. And if you're joining by phone, please verbally confirm your attendance as well if you're not able to use the chat, which I'm not sure. Open my participants. Looks like we only have one individual participating by phone. pause there for a little bit and let you all kind of enter your names. And because I'm sharing, I'm not able to see the chat very well. Oh, just kidding. I'm a little rusty with sharing my screen, so I'm sorry. Now I see it. I'll give everyone a moment just to put their names and who they're affiliated with in the chat. All right, so moving forward, I am actually going to turn it over to Melorine. Melorine is going to give us some follow-ups from our April working group. Melorine.
Thanks, Sarah, and thanks, everyone. So before we get into our main presentations today, we wanted to take a few minutes just to share some of our follow-ups from our April working group meeting. If we go over to our next slide, we're very excited to announce that we have a new co-chair. In our, I think it was 2 months ago, we did announce that we wanted to build this together and introduce a new role of having a co-chair for our working group. And thank you to all of the representatives who did vote and selected our first co-chair, who's Jessica Gokuchia. We're very excited to officially welcome her as our new co-chair for this working group. Jessica is a licensed marriage and family therapist and currently serves as the Human Services Coordinator for Washoe County. She currently oversees all clinical services, including the mobile crisis response team. Jessica, we're so glad to have you in this leadership role. And if you're here, would you like to come on camera and say a few words? Not to put you on the spot.
I am here, and I am very excited and looking forward to this role and being able to do this with all of you alongside of everybody. This is really exciting, and that's all I have to say.
Thank you so much, Jessica. Well, we're excited to have you on board, and thank you again to all of our representatives who did vote and select our first co-chair. So moving on to our next update, we also want to introduce another key partner in this work, who is Tim Marshall. Tim Marshall is serving as our independent reviewer under the DOJ settlement agreement. And on our next slide, we have also a brief bio for Tim to introduce him. He brings over 30 years of experience in children's behavioral health and child welfare. And as our independent reviewer, he supports our work through technical assistance and independent oversight to help ensure progress in expanding access to behavioral health services for children. Currently, Tim serves as a senior advisor at the Innovations Institute at the University of Connecticut and as a consultant at the Baker Center for Children and Families. And I believe Tim was planning to join us. I want to see if he's on. And Tim, we're glad to have you on board. Wondering if you're here, if you'd like to introduce yourself to the group.
Sure, I'm here. So good afternoon, everybody. As said, I'm Tim Marshall, independent reviewer. I don't know if there's anything else I can add. I guess I've just come mostly with the 30 years experience from the Connecticut Department of Children and Families there, just so people know that's an integrated or mostly integrated child serving system. So we had child welfare for many years. We had juvenile justice, which was separated in the more recent years. And we had a lot of early childhood, but behavioral health, substance use, and mental health was in that also. So I come from that 30 years, and I think the last 9 or 10 years, I've been doing a lot of work in consulting in children's crisis work, in particular, mobile crisis or mobile response, stabilization support, MRSS, and a lot of 988 work. So it's great to join this meeting, and looking forward to my work with Nevada. So thank you.
Thank you, Tim. And thanks for joining us today. Well, moving on for the sake of time, so we have a good time for our discussion later on in this meeting. We also wanted to just share some updated information. We had sent out information to our working group representatives, sharing an announcement from our partners at the Aging and Disability Services Division. Nevada's first Capacity Building Institute cohort, it's now underway, which is focused on supporting individuals with intellectual and developmental disabilities and co-occurring mental health needs. While the applications for this round have currently closed, providers and community partners, you can still get involved by reaching out to Tamara, who we have her email address, and I'll also provide it in the chat at the end of these updates, so that you can stay connected for future opportunities. Just wanted to share that here. And then one other reminder that we have is on feedback on our specialty managed care plan. We're still accepting public feedback on the design of our specialty managed care plan for children with complex and behavioral health needs. This is a key opportunity to shape the plan's development and ensure it reflects the needs and experiences of families, youth providers, and other partners. Now you can view the full public comment request on our website, and responses are due by Friday, May 23rd. Feedback can be submitted via email to our Children's Behavioral Health email address, and I will provide the website address again and the email address at the end of these updates so that everyone has it in the chat. And that wraps up our brief updates. I know we have one other update, but I will hand it back to Sarah.
Great. Thank you so much, Melorine, for those updates. I am going to turn it over to Matt Burdick with our division as well for the next update. Oh.
Great. Thanks so much, Sarah and Melorine. For those I haven't met yet, my name is Matt Burdick. I am working with the innovations team here at Nevada Medicaid on all things children's behavioral health transformation, and really happy to be with you all today. We just wanted to provide a brief update about where we are at with the implementation of some key provider rate increases that we see as really critical to supporting this work. I want to emphasize we're hoping this is sort of the first phase of a longer term project to really shore up provider reimbursement rates, which is so key to our infrastructure here, and actually will be key to our success in doing this transformation so that we have providers that can actually offer the services that we are developing, as well as the core services that we already have available, and make sure that that reach is as far and wide across the state as possible. I will put the caveat on all of that we are in very uncertain times, especially in the land of Medicaid. Obviously, our state's budget is still in very active negotiations and has had some ups and downs. And then we've got a lot of uncertainty with what the U.S. Congress will be doing in terms of Medicaid funding. And so what we are moving forward with is what we have kind of, what I'll say, money in the bank for and guaranteed as our first phase, and really see these as really critical investments as we're really getting this work off the ground, with an eye towards a lot more work in this area ongoing. So as the slide mentions, in April of last year, the Interim Finance Committee approved the use of our state's hospital tax fund to increase several key rates for community-based mental health services, really that are designed to support this children's behavioral health transformation work. And so we are in active conversations with the Federal Centers for Medicare and Medicaid Services to get approval for these rates. And hopefully once that happens, they will be approved for services provided back to January 1st, 2025. So providers that are offering these services will already begin to see these increases once that's approved in services they're delivering today. But our hope is with these that we'll see an increase, or at very least a sustaining of our current provider ecosystem, just knowing how hard it is for providers to sustain this. For this first set of services, we're looking at a 10% rate increase for what we think about as our core mental health services, the diagnostic assessment work, as well as our psychotherapy, our traditional talk therapy services, both on an individual and family basis. We are also looking for that same increase to our basic skills training and psychosocial rehabilitation, as well as specialized foster care. And I should be clear that these are all when these services are delivered to children, again, with a hope of looking more expansively down the line. But that is what IFC approved and what we can know we can do in the current kind of challenging environment we have. And then we're looking at a couple of different incentives to recognize that how you deliver services and what it takes to deliver services can look very different depending on the nature of the service and where you are in the state. So we're looking for an additional 10% add-on when services are provided to youth in rural areas of the state, as well as an additional 5% when services are provided to a child in their own home, really trying to incentivize both that rural access as well as access to in-home services, which we know are some of the most challenging services to deliver and to really sustain. So want to recognize this is not a panacea. This is not going to solve all of the problems that we have in Nevada's behavioral health system, but we hope it's a really meaningful start and provides some support and relief to providers as we look towards the future and see what more we can do in this space. So we will keep the group updated as we hear more from the federal government. That's a very lengthy process, and so I can't speak to the timeline of when that will be approved. But as I said, once approved, we are looking to backdate that to January 1st, 2025. And so that would be for services ongoing from that date forward. And then I see we've got a person with their hand raised.
Jessica?
I hope questions are okay.
Please.
The 5% for in-home, is that only in rural areas or is that across the state?
I'm going to ask Sarah to keep me honest here. I believe it's statewide, but I don't want to misspeak.
No, I think you're right, Matt. Definitely statewide. Definitely incentivizing that in-home delivery.
Thanks, Sarah. Thanks.
And Tim, did you have your hand up?
No, my apologies. That was a mistake. Sorry.
Oh, all good.
No problem.
Well, anyone else? Like I said, much more to come on this. But yeah.
Does this apply to telehealth? The additional, is it so the rural, is it, you know, if we're telehealthing into the rural community, maybe in a clinic or in their home, does that additional 5% add on, or is that only physically in person?
So the 10% for rural is intended to be based on where the child is located. So if you're a provider based in an urban area but serving a youth in a rural area, you'd be eligible to get that add-on, is our intention.
Okay, thank you.
Mm-hmm. Anyone else? All right, well, I'll turn it back to Sarah to keep us on track, and I'll be back for a future agenda item. Thanks, everyone.
Great. Thank you so much, Matt. Appreciate those updates. All right, so next on our agenda, we will have a presentation from the Black Youth Mental Health Advisory Board. I believe I did see Isabella on. Isabella, are you able to come off mute? And I'm happy to work the slides for you as well as we move through this.
Okay, can everyone hear me right now?
Yes.
Okay. I think there was another person on the Black Youth Mental Health Advisory Board that was supposed to be here. His name's Zaire. Hopefully he'll show up. If not, I can just continue with the presentation, but thank you for having us here. The Black Youth Mental Health Advisory Board works with the Larson Institute at UNR. The Larson Institute at UNR is home to a lot of other projects that help with health impact and equity across the state of Nevada. And this is just one of the many projects that the Institute has, I believe. This project has been going on for the past 2 years. We're in our 3rd year right now. I joined the project in its 2nd year, so I'm not as familiar with the beginnings of the project, but I'd be happy to present on some of the legislative updates. Right now, the Black Youth Mental Health Advisory Board has around 50 members across the state of Nevada with youth aging from 12 to 17. Right now we're talking about the legislative session because that's sort of what's going on right now. And we're trying to advocate for policy changes that we want to see in Nevada that would help both Black and LGBTQ+ youth in Nevada. Would you be able to move to the next slide, please? Right, so first we started to talk about our personal experiences when we first met as like a whole group. We talked about our experiences with mental health care. I personally joined the project because my sibling is trans, and well, obviously, like, this isn't like the main cause of their like depression, but um a lot of I know like a lot of my LGBTQ friends plus myself struggle to find like acceptance with our peers, um, society in general. And when we do try to seek help, like it's not really help that we identify with, I guess. Like I know that adults are available that try to help, but there is still like a stigma around mental health, and generally, I think even when policymakers do try to help, there's just still an underrepresentation of our voices in policies that are meant to help us. So that is sort of, I guess, like the reason why the project was created, so we could have representation in policy. And that's sort of why we were like gearing up towards this like legislative session. Um, Next slide, please. Right, so before the legislative session, there was a youth-centered policy advocacy training that was created by a group of young people working with the Larson Institute. It focused on how to like talk about mental health disparities, like as someone who took the training, how the Nevada legislative process worked, and how we could help like bring about policy changes in Nevada. I was one of the members of the Youth Advisory Board who was able to go to the state legislature and talk to some of the members of the Health and Human Services Committee in both the Senate and the Assembly, which was a really empowering experience for both myself and the other people who were able to go. And yeah, that like leadership training was really helpful for that. We also worked together to create a policy brief that sort of summarized the main bills that we wanted to support. More on that. Next slide, please. Right, so I wasn't there for the first year, but I know that when the project first started, like the Larson Institute first started to recruit young people from their community partners and established the first Black Youth Leadership Council, which was the group of young people who helped create the leadership training that I took eventually in the second year. Next slide, please. Yes, so in year two, which is the year I joined, a lot more young people joined after the leadership training was distributed. The way it worked was young people were paid $200 to do the training, and then after completing the training, they were invited to join the Black Youth Mental Health Advisory Board, which is what I'm a part of. We talked about legislative changes that we wanted to see. We talked about things that were going on in our own lives. We were also able to provide support to each other. I think it's a really nice community that I was able to join. We also worked together to sort of plan the different events that we would have this year, which is year three. Next slide, please. Okay. So we had a youth policy forum in Las Vegas where we were able to talk to state legislators about the policy changes that we wanted to see. And there were also two different lobby days at the state legislature. So there was the Children's Health Day at the state legislature in March, and there was also the UNR School of Public Health Lobby Day in April that I was able to attend because I live here in Reno. What that basically entails was like different organizations were brought together at the state capitol, and we were sort of taught how to go into committee sessions and give public testimony or public comment. We were also able to meet with other people who were doing really important work in behavioral health and sort of learn what's going on. I think it was a really valuable experience. I know the other people who went thought it was a really valuable experience too. Next slide, please. Right, so these bills were all the main sort of bills that we wanted to get passed in the legislative session. We wrote a policy brief that goes into more depth about what these bills are and how they would help. But the bill that I was personally most excited about was AB 60, which would allow teens aged 16 plus to be peer-to-peer mental health advisors in schools. Unfortunately, when I checked up on this bill in Nellis, they like amended the bill to only allow people aged 18 plus to be mental health advisors, which kind of defeated the whole purpose of the bill, to be honest. But yeah, that was just something that we were excited about. But at least some form of the bill is passing. Senate Bill 54 would provide Medicaid coverage for medical respite care for homeless individuals. We supported the bill because we know that a large proportion of homeless youth tend to be LGBTQ plus, just because like I know I've had some LGBTQ plus friends who didn't feel safe at home and they either ran away or like they got kicked out. So we thought that was like a bill that we wanted to support. AB 48 focused on reassigning not the victims of bullying, but rather the perpetrators of it to different schools and allow like districts, principals, and like other like adults to sort of make that decision. And AB 31 would basically have Medicaid provide for behavioral health transport services for people who live in rural parts of Nevada. So it would basically allow them to go to like either I guess Reno or Vegas, where they have like in-person behavioral health services. I think all of these bills passed committee. I have to check though. But yeah, these were the bills that we talked about both at the legislative session, like the lobby days, but also at our policy forum. And yeah, next slide, please. We also wanted to center, of course, youth voices. Like that was sort of like the whole point of having an advisory board with young people. Like when I go to my school counselor, right? I know she's there to try to help me. I do believe she's a really good person, but sometimes I do feel like that the mental health counselors that I have, like, seem like they either like don't I don't know, represent what I feel like, what I identify with. And sometimes it's hard to connect with like a mental health provider if they don't really understand what myself or the people around me are going through. But at the same time, we want to connect young people with different experiences with mental health to show them that they aren't alone. So we kind of also gave support to each other. That's what our weekly meetings were for. They were, again, pretty valuable experiences. Next slide, please. So we have a few events that are going to sort of culminate the Black Youth Mental Health Project by the Larson Institute. There will be a Las Vegas event at the Discovery Children's Museum from 3 to 5 p.m. on May 30th. It's going to be a really cool event. Like you get like access to the museum, and there will be music. There will be a presentation of a mental health video / art contest that we're holding. So we also get to present the winning entries there too. Same with the Reno event, except the entries are from Reno. It will be on June 18th at the Reno Public Market from 5 to 7 p.m. These are both supposed to be community celebrations and also calls to actions in regards to Black and LGBTQ plus mental health. Um, the public is just welcome and free to go. Please go. It would be really fun. And thank you so much for the opportunity to present our project. Oh, yes, and this was the poster that we presented at the UNR School of Public Health Day at the state legislature. I was able to present this poster to the chair of the Health and Human Services Committee in the Assembly. I was also able to present to a few other state legislators, and it was a pretty cool experience. So, yes.
That's awesome. Thank you so much, Isabella, for presenting on that. Such great information, great advocacy that is happening and really exciting to hear. Is there any questions for Isabella? I didn't see Zaire join. But I'm just moving through the chat here to see if there's some questions in the chat. Just lots of kudos for sure, Isabella. Thank you so much.
Thank you for having me.
Of course. Yeah. All right. So keeping us moving. And if you have questions that you're thinking about, we definitely, hopefully we'll have time at the end as well if there's some questions that come to mind. But moving on, I'm going to turn it back over to Matt, and we're going to talk about youth peer support services.
Great. Thanks so much, Sarah. And thanks so much for the presentation, Isabella, and the work that you all are doing. It's just really inspiring to hear. And I hope that in the future, and today and in the future, you all can help us inform some of the work that we have ongoing here. This topic feels very pertinent, and I already heard some feedback in terms of the design of this that we might want to incorporate. So thank you. So today we're going to talk about one of the new Medicaid services that we are developing as part of our transformation project. What was known as youth peer support and might feel similar to services that people are familiar with. Currently in Nevada, we cover adult peer support, which is people with lived experience with either a mental health issue or substance use disorder, and who provide support to people who are still actively navigating those systems. We have also talked among this group about the development of a family peer support model, which we've had in Nevada for a long time, but are now developing as a Medicaid service. Youth peer support is kind of the final piece of this puzzle, and something that is also not new to Nevada. I believe NAMI and other organizations have offered a version of this, but it will be new to our kind of Medicaid ecosystem. So we're going to spend a little bit of time talking about what it is, just to ground everyone, but I really want to spend the bulk of the rest of our time on this topic hearing from you all. And we've thought about how we are seeking your input on this a little bit differently. So we've got kind of our processes that we have to do. We have to submit a very formal document to the federal government to kind of outline the details of what the service is. And then we put together our Medicaid Services Manual, which has all of the information that people providing the service need to know about how to bill for it and what's allowed and what's not. But I think what we're most hoping to get from this conversation today is just a better sense of, in an ideal world, what could this service look like? What could, where could it be offered? How could it support youth and families? So less so about informing those kind of rote policy documents that we'll be developing regardless, and really trying to inform as we develop the service and we start having people offering the service, what does it look and feel like to families in Nevada, and how do we make sure it's having the impact that we want it to? So just by way of background, it's a service that's provided by trained young adults who have similar life experience, who support other youth who are navigating behavioral health issues and systems. Really, the goal is to be that trusted messenger and hopefully a trusted connection point to that larger system of care providing that, lived experience, that empathy, that support that you can really only get from someone that has shared experience with you, and not always from the folks that are delivering the care. And it can also help kind of translate between those worlds. And this is something that the settlement that we have with the Department of Justice mandates us to do. But it's something that I think we would need regardless of the settlement, but it is a key component of what we're offering here. Next slide, Sarah. Thank you. So just a little bit of grounding about kind of the nuts and bolts of the service. Peer support would be available to the Medicaid eligible youth under age 21. And really those experiencing behavioral health challenges and who would benefit from peer support. We were just talking earlier today about how do we really make sure that we're engaging youth that don't necessarily have a formal diagnosis and not creating arbitrary barriers to who can access this based on how kind of far into the system they may have gone at this point. One of the goals of this service is to potentially alleviate need for higher level interventions like going into residential care if we're able to make the supports and connections we need earlier on in a youth's journey. In terms of who is eligible to provide it, we're looking at, again, youth who have gone through a state-approved training program. And right now, the age range that we've been talking about are 18 to 30. And that's based on experience of other states, conversations with NAMI and others locally here about what's the age range of youth who are kind of probably ready to deliver this in a Medicaid context, but also close enough in age and experience to the youth that they're working with. I am I'm older than this. Connect to the life of a 17-year-old or a 16-year-old in today's world. I didn't grow up with all the same pressures and other things that are going on in a young person's life. So I can't really speak to that experience. And so thinking about how do you tie those experiences to sort of a similar generation. And then what can Medicaid pay for? So again, it's that emotional support and mentorship. It's really helping the youth build the skills they need to be advocates for themselves and to build the confidence that they need to really assert what they need as part of this process. Really useful in terms of crisis de-escalation, having that trusted person that you can go to when you feel things potentially getting worse, or you just need a kind of someone that you can really trust to help you navigate that. And then being part of that kind of family and support team that is really helping to define and develop the plan of care for youth, and as well as helping to make other connections in the community. And this can take a lot of different forms. It could be in individual or group sessions. It can be delivered in person, by phone, including text message, could be video chat as we're doing now. And then a lot of coordination on the back end with those other service providers, kind of, again, being that liaison between the youth and the broader care team. Next slide, please. So I believe we've got about 3 slides with different questions. And so I'd like to just pause at each one. I think we would just love your feedback and thoughts as we are thinking about this. I will say this is a service that's brand new for those of us in Nevada Medicaid, and we've spent a lot of time talking to other states and looking at how the nuts and bolts of the operations of it all, but there's just still so much that we don't know. So would love just to hear from you all about how you would see youth peer support integrating with other services if you're coming from the provider, the therapy lens, or from school counseling. What sort of training would help the clinical staff or the social services staff feel comfortable engaging and supporting peers? And then any just feedback people might have around supervision or referral to make sure that this service is something that has the appropriate oversight and support to really be successful, and that youth and that the peers delivering it feel safe and supported into delivering all of that. And so I see we've got people queuing up in the chat. I'm wondering, Sarah, if you're able to see names, otherwise I can call folks out as well.
Yes, I've got it. Thank you so much. It looks like Dr. McGrew, you've got your hand up first.
Sure. So I love this as an option for youth that are struggling. The angle I'm coming out of, especially when I look at safe implementation, is I have immediate concerns about how are these individuals who are offering the support being supported. They are young, they've had challenging backgrounds themselves, we're asking them to do a lot of emotional labor where the connection is the point. How are we going to make sure we're supporting them adequately so they don't get lost in the sauce? So that when they're filling in all these gaps, they're not getting pulled down, they're not getting burnt out, they're getting adequate levels of support to maintain their own mental health.
Thank you. And I will say we will probably, just in the hopes of getting as much feedback as possible, not respond to each one. And also, we don't have all these answers, which is exactly, you are touching on an issue we have really wrestled with as well. So I appreciate that. And your framing is actually really instructive. So I will say this will also not be the last conversation of this. So thank you for that. But I just wanted to preface that so in case people aren't waiting for me to respond to each comment.
Sure. It's just, I think, a consideration that needs to be taken on board, and considering like what an appropriate caseload would be, how, you know, far an individual can be expected to stretch, and what support they would have available to them.
And thank you. Yeah, that exactly. And some of that really specific feedback is super helpful, like thinking about caseload ratios and do we need to really make sure we've got some strong parameters out there. That's helpful. Thank you.
Thank you, Dr. McGrew. Carly, see your hand up?
Hi, I just wanted to share, Nevada PEP recently did a focus group with parents who have children in this target population about the children's behavioral health transformation overall. And when we talked about the benefit set, peer support was really one of the services that parents honed in on and were really excited about. And particularly, they wanted to ensure that youth peer support would address social skills, and they felt it might be helpful in a group setting in sometimes where youth could interact not only with the youth peers but with other youth their own age as well. And then I just wanted to touch as well on that supervision piece, that coming from a peer support lens myself, I feel like you kind of have to address the youth a little bit differently where they really may need that clinical supervision and the support in that way. Thank you.
Great, that's very helpful feedback, Carly. Thank you. Dr. Freeman?
Hey everybody, this is Dr. Freeman. I'm really excited to see this service take off in Nevada. I agree with Isabella that it would be awesome if we could have younger persons trained to do this as well. Some teenagers really want these types of leadership roles, and I think it's like another layer of it, you know, maybe like a second phase of it once we figure out how to make it work. I want to be really careful about internalized like bias or internalized stigma around sort of how we think about their ability to provide support because they're coming from a lived experience perspective. I agree that especially young people are going to need opportunities for supervision and guidance, but their adults and their lived experience is just going to add to their ability to offer the service, you know, not provide any kind of barrier. And then similarly or kind of related, I think we need to be confident in whatever training and certification process we develop, that we can train this person as a paraprofessional and then let them go and do their work with limited or no oversight. I don't think this should have requirements to be integrated into a treatment plan. I don't think we need to say like, oh, you have to have X amount of ongoing supervision. I don't know anything about how peer support is implemented elsewhere, so this is just my own thoughts based on my experience practicing in Nevada. But the more barriers and restrictions we put on paraprofessionals, when paraprofessionals can help us meet the need in a severe workforce shortage, I think that just doesn't make sense.
Thank you. That's a lot of great feedback. Sarah, who's next on our
Dr.
list?
Freeman. Looks like Janann.
Hey everyone. So we currently employ peer supports right now here at Carson Tahoe in our crisis stabilization center. Soon we'll be having a youth crisis center, so we're really interested and looking forward to how we can support youth peers. Just from my experience of working with peers and supervising them in a leadership role, I'm not a peer supervisor, although I do attend all of their meetings. ways that I think is best to support them is first and foremost, pay them what they're worth. We have really competitive wages here. I have tons of applicants for peers. Our peers who work here say that, you know, and I'm not just meaning like the dollar amount, but also like making sure they have access to medical and, you know, our EAP program. Like I think we talk about EAP pretty much every meeting just to make sure everyone is supported mentally and physically. And also I think of the risk that they have of being kind of exploited sometimes, like overwhelmed. We're very, very mindful of utilizing our mental health days, utilizing FMLA. We have actually updated our sick call policy for all staff because it was very strict and maybe a little bit less, there wasn't a lot of equity amongst professionals in general. And I think on the terms of supervision with the peers that work here, they range from ages 24 to, I mean, probably about late 40s. So a little bit outside of that age range there. But I find what supports them the most is that they want the supervision. So they want to come and talk about, they know their scope of practice. When they're working with our therapists understand where a peer can enhance their work, where to let a peer do the connecting. So it works very seamlessly here. Something that we didn't think of when we brought peers on was our staff language, like how in a hospital setting, especially in a crisis setting, we may not use person first language. We may have, there are different levels of burnout. There are different levels of dark humor. There are protective factors to that, but it became very abundantly clear that the way that we speak about patients is also how our staff and our peers are going to internalize that. So we've launched a lot of like person first language, a lot of, what are the words I'm trying to say? Anyway, just being mindful of how we talk about our patients and talk about each other. It has enhanced our work, I think, that our peers have taught us so much that I can't say enough. I think they're fantastic, and we're really eager to figure out how youth peer support's going to work for us. So love them. We need more of them. Pay them what they're worth. Give them good benefits and insurance.
Thank you, Jan. Ashley?
Hey everybody, Dr. Ashley Greenwald. I am a research associate professor at the University of Nevada, Reno, and the director of the Nevada Positive Behavior Interventions and Supports Technical Assistance Center. So in my role there, I oversee statewide implementation of MTSS across the schools in Nevada. I am very interested in this. I'm really pleased to hear that this is, coming up through the state of Nevada. I've heard other states talk about this at a lot of national conferences. Really pleased to see that it's going to be Medicaid reimbursable. And so I do have quite a few thoughts about how to maybe potentially integrate this workforce into the schools. It's, definitely probably a conversation that is a little bit longer than the time that we have available today. But, my sort of like initial response reaction is like tier 2, right? Those are sort of those like at-risk groups where we provide some targeted interventions inside of schools. The supervision piece is something I've got to think through a little bit. And, I'd love if there's an opportunity ever to brainstorm with you all on what that potentially could look like inside of a school setting. But, from a workforce perspective and what's going on in the schools, the needs are greater than the capacity of the providers and the workforce inside of the school settings. And that's, not unique to any one community. We see that in our urban communities, we see that in our rural communities. And so I think, leveraging the talent of people with lived experience that have a passion to support others could be very beneficial with a low risk population, and then really providing some good supervision and setting up some processes in place and systems in place for, how to support those staff when they recognize that, this is more of a clinical need, and then help to advance those youth to tier 3 services or more clinical services. And as far as a referral process goes, MTSS sets up referral pathways inside of schools regularly. And I do think that that's probably something that we can just leverage and talk about what potentially the youth peer support person could provide. I don't necessarily see them providing intervention per se in the way that we talk about intervention in MTSS being like assessment and formalized instruction. But I do see it as a very valuable support, hence positive behavior interventions and supports, and that they could play a really valuable role inside of schools when there's just, not a significant workforce. So if there's an opportunity to speak more about that, I'd be glad to. I'm also going to drop an article in the chat. I just did a quick search and I found one that is interesting that I have not yet read entirely, but I've been skimming it as we're talking. Thank you.
Thank you, Dr. Greenwald. Karen?
Hi, I just wanted to say that I put a guide that was developed by youth peers for youth peers that has a lot of good information about how to integrate and how to supervise and what is needed to make this successful. So I hope you grab that out of the chat.
Thank you so much for the resource, Karen. Isabella?
Oh, hi. I help run a peer advising service at my school. It's not to preface, it's not providing mental health services. We're supposed to refer students who are struggling with mental health issues to the school counselors, but we help with academic and social advising to support like all of the other peer advising liaisons who are in the program. We have weekly team meetings where we sort of check in on everyone and we talk about the meetings that we've had like that week with our advisees, just to make sure that we're doing the best we can and also that we're checking in to see what everyone else needs. We also have a teacher who's sort of like our advisor. So we do have adult supervision, and everyone who's having meetings with new students, that's what the service is for. We have like sort of like meeting logs that we fill out to make sure that we're staying accountable and we're making sure that everything we're doing is like not like sort of crossing a boundary, I guess, where we would need to get a school counselor. But obviously I'm not an expert, so I can't really comment on like what like the program should do, what you guys are doing. But I know it can exist at schools, and I think just not only having like peer support, like people who are working in peer support, like they shouldn't work alone. They should be able to like build a community with other people who are also working in the same program, and just probably having like a centralized training beforehand would help. We have training, like a training session where we onboard new members every year. So that could probably help as well. I know it's possible, so you guys are doing good work.
Thank you, Isabella. I
Thanks
want to
so much.
recognize, oh, sorry, go ahead, Matt.
I was just saying, I recognize that there was a comment in the chat, which I think is actually germane to our next slide or the one after about training. So I was thinking that was a great segue if we want to move to some of these next questions here. And so what, as we've been talking about this, how do we make this service accessible? I think we've gotten that through some of this feedback. What are the issues around confidentiality, safety, or eligibility that we need to think about? And then, yeah, I think we really need to think about how can we ensure both that our peer services kind of group of providers, if you will, is representative of our community here in Nevada, as well as what training do we have to make sure that the youth peers are really supported in surveying a diverse cohort of their peers. Just as by way of background, we plan to work with our kind of current certification bodies to use sort of the basis of the peer training that we have today. But really we'll need to have a lot of, I think we'll have some specialized training specific for youth peer, just given the uniqueness of this service. But would love feedback and ideas that folks have. So this is very much in the early phases of that. And so those are exactly the questions to be asking. Would love input from this group on those topics.
I think these are really great questions that have been posed, and I think the feedback from everyone has just been very insightful. I would certainly want to look at what other states are doing, and maybe even other countries, really to look at the data and look and see what's been effective and see how we can duplicate that and make it even better. Thinking about this, I would worry that a peer we would want to prevent them from feeling siloed, right? And so I think the team-based approach is so important here. Not only when we're thinking of how do we help clinicians support, right, the role of a youth peer, a lot of that is educating the clinicians about what education, what training, the value of lived experience, the supervision and oversight, and or lack thereof, right? Depending on kind of what we all decide, but really educating the clinicians on kind of the role of the peer and how they're really an integral part of the team, I think will help the peers be fully integrated. But I think a team-based approach is really important. I'm thinking as a parent, if there's a peer, I imagine parents would be worried about, who is this other young person who's advising my child who's struggling, right? And so really helping the parents understand that this is a team, we're all working together, right, with a shared goal of helping your child do the best that they can. So looking at best practices, looking at data, really educating, the entire workforce on the value of lived experience, and then a team-based approach so that everybody's really working collaboratively in all their different spaces with a shared goal of helping the child improve.
Thank you for that, Dr. Cooper. May I see your hand up?
Yes. Hi, everyone. My name is May. I'm with the Larson Institute, and great job on your presentation, Bella. And so part of my role, I'm a public health advisor, kind of helping all the youth in our programs. And aside from that, I'm also an online training coordinator. So this is right up my alley. And as we have worked with the youth to kind of create the training on how to advocate for themselves through mental health policies, that's kind of the idea that I'm having here, is that providing culturally sensitive and competent training for these youth that will become providers. And so just as that was stated, we need a whole team with parents, with professionals, with youth themselves. So what kind of, as a youth from a different ethnicity, from a different culture, what is it that that they would want their peers to know? So really talking about culture and how mental health stigma and what's taboo in someone's culture and background comes from. I think that these conversations really need to be held in order to understand one another, and then to really best support each other as youth and understand how to provide the best support.
Thank you. And thanks. I see some feedback in the chat. This is such helpful feedback. We are capturing this all, and so appreciate that. Sarah, I know we're running almost to the end of our time, but I think we can go a few minutes over. We've got one more slide. And I think these are all the questions that we often ask ourselves as we're developing new things, is how can we reach rural, tribal, and underserved areas as we're rolling this out? Thinking about organizations that can help us kind of expand our reach, both in some of the training opportunities that were discussed, and some of the resources in the chat have been amazing, as well as just sort of getting the word out about this service. And, I'm even thinking about how do we recruit young adults to want to go into this, to the service. And then how do we just continue ensuring youth and family voice kind continues as we're rolling this very, it's not a new service to Nevada. There's a lot of people, as been talked about tonight, doing great work, but it'll be new to the Medicaid world, and we want to make sure that we're not limiting or kind of putting blinders on about the most important voices in the room as we develop this. And so would love just any final thoughts or feedback on these. And then this is not the end of this conversation. So this is just the first of many as we are rolling this service out.
Thank you so much, Matt. And as you mentioned, still a lot of great insight happening in the chat, so definitely appreciate it. Just recognizing the time, we are going to wrap up today. And just for a brief takeaway, our next meeting is scheduled for Thursday, June 12th from 4:30 to 5:30. Which takes us to one of our last items, which is public comment. Keeping it to 3 minutes if possible. The final, I already said that, sorry. No action may be taken upon a matter raised under the public comment period unless the matter itself has been specifically included on an agenda as an action item. Comments will be limited to 3 minutes per person. Persons making comment will be asked to begin by stating their name for the record. If you wish to provide public comment and are joining by phone, please press *5 to raise your hand. If joining by computer, use the raised hand icon at the top of the screen. Is there any public comment for today? Wonderful feedback in the chat. I appreciate it from our conversation. It's a great idea, Dr. McGrew. We'll be sure to take that recommendation back and consider all options. There is so much always to get through and so much to talk about, and we really hit a good stride moving through, and then it is time to end. So definitely recognize that. All right, not seeing any hands raised or hearing any. We certainly appreciate everyone's time. We know it's late in the afternoon and you all have demonstrated amazing fresh brains today. So thank you so much for your participation, and we look forward to next month's meeting as well. If you do have any feedback or questions, feel free to reach out to our children's BH at dhcfp.nv.gov email inbox. I hope you all have a good Thursday afternoon. Thank you.
Thanks, Sarah.